About 15 months ago, I started experiencing some tinnitus, ringing in the ear, very aggravating, and it would last for a little bit and go away, and then it lasted a little longer, and then within a week or so, it was continuous, 24/7, never stopped, hasn't stopped since. I started getting headaches, and the headaches were not continuous. They would go away. I would take several pain relievers and they never worked. And I had talked to my general practitioner, and I also started seeing a dentist about a month and a half after, maybe sooner than that, about a month or so, because I had some pain in one of my upper molars. And they said that I was needing a root canal, and I had a root canal done. 2 weeks later, the pain was twice as bad in that same tooth. The root canal did not work. 2 weeks later, I had the tooth pulled, and it didn't help with the headaches. It didn't help with the TMJ or the tinnitus at all. The headaches, they were continuously every day after that. I was then recommended to an ENT, and he recommended that I have the sinus-plasty, which is a balloon going up there and exploding and busting the bones. I saw another ENT. He said that everything's clear. The MRI came out clear, or the CAT scan came out clear. I had 2 CAT scans. I had 2 or 3 X-rays on the jaw with the dentist. At that point, I saw a neurologist. The neurologist examined me and wanted me to go through, wanted to prescribe some drugs. I was prescribed Valium, Xanax. None of those worked. I didn't like them. They made me groggy. All my vitals and blood work comes out good. So about 2 months ago, the oral surgeon recommended that I come to your facility. I was feeling that this is the end of the road. So yes, I was hesitant, but I know that there's got to be something out there to help this. When I first came here, I felt relaxed. It's a great facility. The staff is phenomenal. The people that work here are just so caring. As we've been working, the headaches have gone away. For the last week and a half to 2 weeks, I felt great, and that's a good thing. That's what I need. That's more important. Tinnitus is just a sound, aggravating, but just a sound. One of the things I didn't realize is how the neck was involved with this. I thought TMJ was just temporal mandibular joint, that area. But I didn't realize that some of my headaches were coming from the back. One of the issues that I had was my jaw wouldn't shut right. I couldn't talk right. I couldn't chew right. And I would notice that, why does it feel like it's out of whack? And that was the first relief that I noticed, was that my range of motion on the jaw and everything, it was a lot better. That was the first thing that I really noticed. I didn't expect any of the work on the back, on the spine, on the muscles, and in the back of my neck. That was unexpected, and I think it helped out. Like I said, I would leave a session, and I felt good walking out that door. I absolutely did. If I knew somebody that was having symptoms that are very similar to what I had, I would strongly suggest to stay away from the surgery first. Like I said, the teeth, I don't believe there was a reason I had to lose that tooth. And that's what I would recommend, starting with that first, and then going with something that, if you want to call it more extreme, that could be more permanent, where a simple change in lifestyle, in following the program that you had, because you asked me, you said, please, don't give up on 2 or 3 weeks. Go at least 8 or 10, and I was in 100%, and that's I would strongly recommend that, absolutely.